Very common condition is formation of itchy hands with small blisters on the sides of the hand. This common condition, which is often seen in summers, is called formalics, which is like a type of allergy which happens usually seasonal in the summers when the pollen allergy increases. When we talk about skin allergy testings, dermatologists talk about three types of tests. One is the skin prick test, which is known as RAST. Second is the skin patch test, which tests for delayed hypersensitivity, and the blood tests, which are available for testing food sensitivities. So there are different type of allergies as defined by dermatologists. As a patient, you may assume that it is only one type of allergy, but the type of allergy which cause a type 1 hypersensitivity, which is as soon as you're exposed to something, you start getting allergic reaction. It could be a medicine. As soon as you take the medicine, you start getting allergic reactions. Those can be identified by a skin prick test. This is called a type 1 hypersensitivity test. The type 2 hypersensitivity test, which is the delayed type of hypersensitivity, which is known as the patch testing, can be done for people who have allergy to certain cosmetics like hair dyes or to nickel. Some people are allergic to some metal, and it can be identified by using something called a patch test. The third type of test is a blood test, which is very commonly done to identify allergies to food as well as pollen. But this is something that is not standardly accepted worldwide. In fact, the Allergy Institute of the US says that these blood tests are not valid and they may not be able to identify any food allergen test. So if you feel you have an allergy and needs testing, you need to identify what type of allergy do you have. Is it an urticaria? Is it like a delayed skin reaction, or is it a food allergy? And depending on that, the dermatologist or your allergy specialist will prescribe you the correct tests which are needed to identify what is causing the same. Hi, I'm Dr. Rasya Dixit. I'm a dermatologist practicing in Bangalore from the last 18 years. Very common condition is formation of itchy hands with small blisters on the sides of the hand. This common condition, which is often seen in summers, is called formalics, which is like a type of allergy which happens usually seasonal in the summers when the pollen allergy increases. People who are prone for this formalics develop tiny water blister like lesions on the sides of the fingers. And these very itchy lesions often make them very uncomfortable to work because they are busy scratching. So one of the common causes is because of the weather change itself, because the patients have got the tendency to formalics. You have to make sure that you're reducing the amount of hand wash or hand sanitizer being used so that you're not stripping the natural barrier of the skin. Use a lot of emollient, use a gentle hand wash, and emollient means lots of moisturizer every time you wash your hands, and then use a mild steroid cream and an anti-allergy tablet to control the amount of itching. Remember, formalics could also be confused for other hand diseases like scabies, which can also be intensely itchy and associated with blisters, and in children especially, it can be confused with the hand, foot and mouth disease. This being said, the best person to diagnose which type of hand eczema you have, whether you have a formalics, you're a HFMD, or you're having a scabies, is your dermatologist. So it's a simple enough condition to treat if you get the diagnosis right. Go to see your dermatologist today.